Hello, ladies and gentlemen. Thank you very much for joining me today in this live webinar on the causes and natural treatments for inflammatory colon conditions. Now, this is going to include an explanation of the many causes and dietary guidelines and herbal remedies used in Ayurveda for treating ulcerative colitis, IBS, and Crohn's. And the whole spectrum of inflammatory colon conditions. Many times these conditions, for example, IBS, there's a wide spectrum of states even stages of this condition. It can be from just a little bit of pain and occasional loose stools, and then diarrhea and loose stools in the early stages with even no pain. And then later stages, it can be chronic pain with every meal, diarrhea 7-10 times a day. And then, of course, in the later stage, then we can have ulceration and ulcerative colitis, where there's actually bleeding. Now, usually when we're talking about IBS and ulcerative colitis, we're talking about in the colon, particularly the descending colon. But then there's Crohn's disease, and this can take place in the small intestines as well. But basically, they all come under the heading here of inflammatory colon conditions. The colon becomes inflamed, and ultimately the intestinal villi inside of the colon is damaged. The intestinal microbes, the healthy bacteria is destroyed. There's symptoms similar to leaky gut, often in the early stages where the person's reacting to a lot of foods. There's food hypersensitivity. These can be early stages. So I personally don't need to classify these conditions into ulcerative colitis, Crohn's, or IBS. I mean, ulcerative colitis, we have the bleeding factor, and that does make a big difference in the treatment. But it's really the degree of the symptoms, early symptoms of just hypersensitivity on one hand, compared to, bleeding in the rectum and extreme pain on the other hand. The medical classifications really are of not much value, except to communicate what the diagnosis has been, so we know where to start. But many times people are not often diagnosed with full IBS or irritable bowel disease, but they have the sensitivity, they have the pain, they have the inflammation, they have the intestinal diarrhea, they have the loose stools occasionally. But when the colonoscopy is done, they do not see the inflammatory condition of the colon in the early stages. Sometimes they can just see the mucus. So, I think that colonoscopy is a very limited form of diagnosis. I think I can get more information from questioning the person about their diet, questioning the person about different foods they're reacting to. For example, if they're drinking water and having pain from water, we know it's in the more extreme level. If they're still eating beans and a lot of salads without much pain, then we know it's not too bad. So just by different foods, which I'm going to cover, can determine the degree of the inflammation without the very evasive colonoscopy, which doesn't really treat anything, but only gives us some information. Of course, if we're looking for polyps or tumors, it can be very valuable. But here we're talking about inflammation in the intestinal lining, the destruction of the intestinal villi, and the healing of that back. So I've been treating this condition now for more than 10 years. And of course, I learned from my Ayurvedic doctor in India. And I've learned more and more every year. I've got better and better at treating the condition. It's a very tricky condition to treat because not only are these different degrees, there's two major types. One is the pitta type that usually has more bleeding and more loose stools. And then there's the vata type that has more like loose stools and constipation and alternating. So there's stages of the condition, and then there's two major types of the condition, pitta and vata. So, of course, determining whether the two types, pitta or vata, that's very quick. It can be done almost immediately, talking to the person. If the person's got a warm body temperature, and particularly if they have heartburn and acidity and they're warm, then we know it's pitta type, even if they're not having bleeding or a lot of diarrhea, just loose stools. We know that's still classified as our pitta type. Pitta, of course, in Ayurveda means fire. So it's a more burning. There's often burning sensations involved. And then the vata type, there's more dry stools and there's more alternating between constipation and loose stools and less diarrhea, usually not ulcerated and bleeding, but plenty of gas and bloating and abdominal discomfort. But that particular person usually has a history of constipation, a history of weak digestion, a history of sensitivity. Their body temperature tends to be cold. They tend to be thin and depleted. And we're going to talk about, to some degree, the two types. But, you'll see some of the formulas that we provide. There's two of every one. We have two IBS formulas, one for pitta, one for vata. We have two healing gut formulas, one for pitta, one for vata. So we have everything separated, in these two different types of treatment. And then as the person's actually improving and the pain's getting better, the inflammation's coming down, they're able to eat more foods, or usually the first stage is stop the bleeding, then stop the diarrhea. Then the treatment has to change too, because the condition is progressively changing as well. So it does take ongoing, consultations to keep modifying the herbal treatment and to open up the diet. Unfortunately, most people make the mistake with this diet of just being extremely restrictive because they become quite fearful of eating foods. So they start panicking and start usually down the same path. Of course, they try medication and steroids and other medications first for a few years. And when this becomes fruitless and ineffective, then they move on to, trying to treat it themselves, which I don't really think is possible. I haven't seen anybody be able to treat this condition by themselves. I think you really have to be an advanced herbalist and have experience. I think even me telling another Ayurveda practitioner what herbs I use is still insufficient without the experience of having all these multiple cases and experiencing the multiple variations. But what most people do is start eliminating things from their diet. But unfortunately, they don't really know what they're doing. So they usually start off with no dairy. That's first, let's just say, big mistake, because butter, ghee actually is very healing for this condition. And unfortunately, they throw that out the window. Usually milk is counterindicated, and that's a problem. Strong fermented foods are counterindicated, but including yogurt in most cases. In the early cases, you can have a little bit of yogurt water. But throwing dairy out besides milk is counterproductive and actually makes the person more vulnerable, more depleted, lowers the fat in the body, which, thins the mucosa lining, and the body needs fat to protect it. Every cell membrane needs fat to protect it. The mucosa in the colon needs fat. So when they leave off the dairy and often don't have sufficient fat in the diet, it actually only makes the condition worse. The next thing they do is they leave out all dairy. I mean, no, not all dairy. I said that one. All grains. They usually say carbs, but we know they just mean grains. Well, they leave out all these grains, and that's also another mistake because they're just going to end up with more depletion. In fact, if they have diarrhea and loose stools, we just give them white rice. Now, of course, many people know that white rice is very low in nutrition, extremely constipated, and as the Japanese discovered in the late 19th century, you can have, beriberi disease, a type of nutritional deficiency from just eating only white rice. So it's not a healthy choice, but for loose stools and diarrhea and bleeding out the colon, white rice with just 1 spoon of yogurt, which some people said look like glue. You get white, dry rice, kind of like the Japanese white rice, where you could pick it up, put a spoon of yogurt and mix it up, and it literally looks like glue. Well, you eat that, and that really reduces down the loose stools and the diarrhea quite quickly. So that white rice trick is very effective. But after they're no longer having the loose stools, we move generally over to brown rice. So leaving out grains is another big mistake, because rice actually is used in this treatment, as well as dairy. So over eliminating is a big problem. And of course, we're going to talk more about some of the common causes that cause this condition. But let me share with you a few testimonials here. These are all on my clinic website, under colon conditions. Here we had a serious case of IBS, and I resolved it apparently in a couple weeks. You could go and read the details from this, but that's the sum of it. And this person here, I no longer spend hours in the morning with IBS symptoms. You can go into the details. This one's interesting because this person thought they had a celiac, a gluten intolerance, and much of their life they was very careful and avoided all forms of wheat or gluten. And after they recovered from their IBS, they were, here she says right here, I'm also able to tolerate gluten, which she never thought was possible. That's right. So this celiac and these gluten intolerances, these are usually the signs of the early stage of this inflammatory bowel condition. And you basically could say, the intestinal lining becomes somewhat raw and hypersensitive, and then ultimately inflamed, and then ultimately could be ulcerated. So again, this celiac is sometimes just another reaction, and people, again, just eliminate the wheat or the gluten, thinking that's going to solve it. And then later on, they have the IBS. She had the gluten intolerance probably for a long time, she says, maybe decades. And then it really never solved anything. And then the inflammation just got worse. And then it became IBS, where she had much more pain. And when I resolved it, she was actually able to eat wheat again. That's a very good case there. This person, IBS, better in 3 days. She was rushed to the ER with severe pain, and doctors only gave her something to reduce her acidity. She had a heartburn. So knows she's a Pitta type just from the fact she had the heartburn and the acidity. And then within 3 days, she had no more pain. Here's stomach constipation, bleeding, nausea, vomiting. I'm not sure. This person had a type of diarrhea and pain. I think this was a type of IBS case. Now, this is probably my best testimonial I wanted to share with you. This person was a medical doctor for 39 years, an MD. His name's at the bottom. The original testimonial was much longer. I hacked it down a little bit, but he did have a serious case of ulcerative colitis, and he went to the hospital, Sinai, one of the best hospitals in the world, for ulcerative colitis. The gastrologist treated him with prednisone, and recommended the specific carbohydrate diet, which I don't follow. He got off the prednisone, and then his symptoms came back: bloody diarrhea, abdominal pain, cramping, etc. And then they wanted him to go on Remicade, but being a medical doctor, he was aware of the horrendous side effects of Remicade, so he refused to do it. And that's when he started with me. Then he goes on and say that his diarrhea was stopped in 2 or 3 days. Blood in the stool continued to improve over the next 8 weeks, and then he became symptom-free. So that is a good, solid testimonial from a medical doctor, and I'm sure those testimonials are one reason I have daily cases of IBS. So let us continue here on this subject. And talk about the common causes. Now, one of the major causes is excess antibiotic use. And I I don't know if it's a medical term, but I have heard in India the term antibiotic induced inflammatory colon conditions. So, where they're saying that is the cause. I'm not sure if that same terms are used in the United States, but I have heard that in India. And so we can see a person who's maybe had a long history of taking antibiotics for maybe a urinary tract infection. And this is, of course, slowly destroying their healthy bacteria, making their intestinal lining more vulnerable, and leading to this inflammatory condition, usually first starting with leaky gut, hypersensitivity to different foods, and then it just keeps progressing. Other causes from my own experience are raw food diet, particularly kale smoothies. There's many aspects of kale smoothie that's a problem. One, kale from the cruciferous family has high in sulfur, and they irritate the colon particularly when they're uncooked. So these raw food diets with a lot of cabbage family, not fermented cabbage like sauerkraut, but the raw carriage, particularly these kale smoothies. And also being cold, smoothies tend to be also very poor food combining, where you're mixing fruits and vegetables, coconut oil, manuka honey, what else they putting in nowadays, cacao powder and mushrooms. And then they blend all that up with some raw kale and slug it down every day. That's really creating many health problems there. One, the poor food combining creates fermentation, bloating, gas. The raw kale is aggravating the colon, creating damage to the intestinal lining. So cold foods, too much raw vegetables. I mean, it's true that these raw vegetables and salads are very cleansing, but a lot of times these people aren't overweight and don't need to cleanse. They're not even constipated, and they're having these large amounts of raw vegetables. And you're just like, you're over cleaning, you could say. And a lot of people do that. You could call it, they're on detoxification programs, and they're over detoxing. Even I've seen people who, kept believing they had parasites, and they were doing parasite herbs, with this white wormwood, black walnut husk and wormwood and other these strong herbs that are, of course, they're anti-parasitical, but they're also antibacterial, antimicrobial. And you take them long enough, like an antibiotic, it's going to start killing your own healthy intestinal flora. So I've seen people do that too. These are kind of self-induced cases where you're doing raw foods and cold foods, bad food combining, and, parasite cleanses, detox. And then this is where very young people can come with inflammatory colon conditions. And once you have it, of course, healing from it is quite tricky, even if you stop all of these bad habits. We're going to talk more about that in a minute. So other causes are spicy food, hot foods, chili peppers. And that medical doctor, he was from Pakistan. So I get a lot of Hispanics and Indians and a few Pakistanis who have inflammatory colon conditions, and they got it from too much hot, spicy food. Now, we know that, if you're in a third world country and you're eating in a night stall, and you better put a little chili pepper inside of your food, because that chili pepper is going to, help to fight any pathogens that may be in the food. And it kind of helps in that sense. But excess use of this hot spices, starts damaging your own intestinal lining. We know that hot spices are very good reductionary. They're reducing. They're, I don't want to say cleansing, but they're killing the bacteria. They're killing the viruses. They're thinning the blood. They have a certain scraping, penetrating quality to them. That's right. Penetrating. Chili pepper and cayenne pepper and these hot spices in Ayurveda have a penetrating quality. So, you may not bother you for 10 years, 20 years, 30 years. And you've been doing this for a long time. The human body is incredibly robust. I mean, it can take an incredible amount of abuse. I mean, think how long people smoke cigarettes before they get cancer, how long they drink alcohol before they have alcoholic liver. I mean, the body can really take years of abuse. So you can get away with having your spicy chili food, hot spicy foods for probably decades. but it is a wearing on your tissue in your intestinal lining, and eventually it's killing the healthy bacteria. It's kind of in a way penetrating or reducing down the fat. In fact, for obesity and high fat conditions like fatty liver, high cholesterol, and obesity, chili pepper and cayenne pepper is very good because it's it has a kind of, we could say, fat burning quality to it, where it's reducing down and helping you to lose weight and to thin the blood. But if you're not overweight and you're thin already, and you're not even consuming much fat in the diet, you don't have fatty liver, then you're taking all this chili pepper, and it's going to start, we could say, eating into or penetrating your own tissue. And eventually, this is one of the most common causes, is the hot spices, which of course are the first thing to go. And that's one thing most people figure out, even in the early stages of IBS, Crohn's, and irritable bowel, ulcerative colitis, is the chili peppers and the hot spices have to go. Most people figure that out. They get that far. They just go too far. Other reasons that I've seen, just from my experience of so many cases, and I had 2 new cases just this week, that is a kind of extreme diets, just like an extreme diet that we can get in the South of fried foods, a lot of animal protein, beef and lamb, which contributes to fatty liver and cholesterol. That's kind of one extreme, too much animal protein. Now, the other extreme is kind of like a vegan diet, no animal protein, maybe low fat, a lot of raw vegetables. But the person's not overweight. Now, that could be great if you're obese, but if you're already a thin person, like a yoga teacher or something like that, then, and you're doing these cleansing diets, you're doing fasting, you're feeling juicy, and you're doing chili pepper, cayenne pepper fast and this type of stuff, and you're on this low fat diet without any, animal protein to help build the tissue, and no butter and ghee, which is used in this treatment and helps you. What happens is this person becomes too thin, too depleted. You can see on the back of their hands is very extremely thin. And this thin skin on the back of the hands shows me that this person is not consuming much fat in their diet. And what that results in is their own intestinal lining becomes too thin, and they can, we could have this leaky gut. I don't really like this name, leaky gut, but I'm saying it because what these symptoms are, and we know what it is. I mean, and also they're often having low protein diets because there's no animal protein. Maybe they're just trying to get all their protein from protein powders or something, or eating nuts, and it doesn't work. So they become thin, they become weak. And what is your colon made of? It's made of muscle. So the muscle becomes weaker and thinner. There's less fat. There's less fat, as we said earlier, is like type of protection. It's protecting our body. It's protecting every cell in our body, every membrane, the myelin sheath. All this is fat. I try to use the word protection, oil and protection, instead of fat, since people have a bad impression in their mind when they hear the word fat. So I say, this oils, this ghee, these are protection. They're lining your intestinal lining. I always say to new clients, you need to think of this condition like having like a big giant carpet burn on your arm. It's not bleeding. It's not broken. It's just like red and raw. And, if you touch it, it's sensitive. So you can really determine quite quickly what you can eat and not eat by just thinking in those terms. And then you can just look at food and whether this food is going to harm or, inflame this condition. By just imagining you had this big red rash, big carpet burn, you could just see little drops of blood on it. It's so sensitive, you can't even touch it. That's like, ulcerative colitis or an extreme case of IBS. it's like a big carpet burn. So it's very simple to realize what you should be doing. First, no hot spices. I mean, cayenne pepper. Go put some cayenne pepper on your carpet burn. It's going to really hurt more, not less. Now, of course, cayenne pepper can use to stop the bleeding, but in extreme cases of heavy bleeding, you can put cayenne pepper on. It will stop the bleeding, but it will hurt. So any spice is going to hurt. So anything hot can actually hurt. Even ginger can hurt. I had one person, they were taking turmeric capsules every day with IBS. So see, they know it's anti-inflammatory, and Ayurveda doesn't even really use turmeric as anti-inflammatory. So I think that just came from some research there. We mostly use it as an antihistamine. I digress. So back to the big burn on your arm is a way of understanding what you should take. No hot, no spicy, and then no sour. Remember that big burn on your arm? Try squeezing some lemon juice on it, or vinegar. Probably putting vinegar on it. It's going to burn. You're going to be yelling. You're going to be, So obviously all vinegar's out. And what Ayurveda says is no sour. See, we just know anything sour. Pickles, anything sour. Vinegar. So no hot, no sour. And what's the opposite of hot is cool. So you want things that are cool. So this is Ayurveda. It's simple in a way, but it's very, very sophisticated, because we know the hot's making it worse. And a lot of times people feel burning sensation. So we know there's burning sensation, and they're having turmeric capsules and cayenne pepper or something, and they have burning sensation. They're just not putting it together in their head. So we want to do, instead of hot things, we want to do cool things. What? Coconut water. That's one of the best things I give people for IBS is coconut water. And if you've known anybody who's had stomach ulcer, or they drink even water, it hurts if you have a stomach ulcer, but not coconut water. See, so that's one of my questions is, do you feel pain or discomfort even from water? If they do, I just have to drink coconut water, because you have to understand there's 3 stages to treating these conditions. First stage is get it under control so they don't have diarrhea and pain, and they can eat and survive, and they're getting enough nutrition from their food. They're not being depleted and losing weight, because almost all the cases that I see, particularly they've had it for years, they've lost a lot of weight. I mean, they were 180 pounds. Now they're down to 110. They were 130 pounds. Now they're down to 95 pounds. Because they keep eliminating foods, and they become scared to eat anything, and they become confused and anxious, and anxiety only makes it worse. So it's really a vicious cycle that people get stuck in with this lack of knowledge. But so right away, I can give them a diet that doesn't have any pain, just by following these basic Ayurvedic principles. No hot, cooling. Coconut water, and what was the other one? Cucumber juice. And sometimes people discover these things on their own, but we can tell you many things that will work. It's not just one thing, as long as you understand the concept. The second is, so all sweet fruits work. Mango juice is good. Coconut water is good, as long as it's very sweet and there's no sour in it at all. And a second, those foods are actually cooling, hydrating, and sweet, because we also want the sweet taste, not the sour taste. No vinegar, no lemon, lime, grapefruit, maybe a little lime, depends on the condition. If it's not too bad, it can be some lime. And there's another interesting thing about the diet is it has no fish. Now think about this for those who are familiar with nutrition. No fish, no fermented vegetables. What does that tell you? Well, that's kind of like, those are foods that generally were known to increase your histamine levels. Now, thousands of years ago, they didn't really know what histamine was, but they knew that there was a reaction, and that's what, there's a histamine response, and people follow these, low histamine diets. Now, again, it doesn't mean they're treating it, because they're only avoiding something, but all these histamine increasing foods like sauerkraut, fermented foods, and even fish are all left out. Even they knew this thousands of years ago, even though they didn't know what histamines were. But so that is one connection. And also the lectins are usually a problem too. So all the nightshades are left out. And those are, we can also call them like acidic foods. So squeeze some tomato juice on your big burn and see how that feels. It's going to hurt. But so no nightshades and no cabbage family just because of its quality. Now, remember, these restrictions are not for life. They're only to get you through the first two phases: stop the pain, manage it, and then second phase, heal it. The third phase, which is you can open up the diet and certain things you're just going to have to be careful with the rest of your life, like chili peppers going to be out. No more kale smoothies. They're going to be out. So there'll be some long-term guidelines, but most people can go back to eating most foods. And like some of those testimonials, they're back to eating foods they weren't even eating for 10 or 15 years, including wheat and even drinking milk. So, see these idea that, oh, I can't have milk, I can't have this, I can't have that. These are often the early signs of these inflammatory colon conditions, where they're just becoming hypersensitive in the early stages, and they just can't eat certain foods, so they just keep eliminating them. But unfortunately, that's not a treatment. You're just kind of avoiding. You're probably slowing the pathology down by not aggravating it, but you're not stopping the pathology, and you're not reversing it, and you're not healing the intestinal lining. Most people are taking probiotics as well. And that, of course, is important. So people are doing little things, but it's a very tricky condition. And only if you've had experience treating multiple people, I think it's really possible to treat people without the experience. It's very tricky. I see people who are even treating some forms of cancer by themselves, but not ulcerative colitis. So very, very tricky, I think is the right word. And not to say that I am perfect either. I mean, sometimes after I do the follow-up appointment with the client, I change the herbs. I realize I picked the wrong one because I have this big arsenal of different herbal products to provide, and I really have to pick the right one. But what's more common is I did pick the right ones in the beginning, but by the time I do the follow-up a month later, I'm changing all the herbs because the condition changed so much. I've had people who had chronic diarrhea, and a month later they're constipated. So obviously all the products need to change. It doesn't mean they're healed yet. It means I don't have to worry about the diarrhea. So other dietary guidelines, well, it's different for everybody. Like I said, the two main variations, the Pitta type with a chronic loose stools and diarrhea, and then the Vata type with the alternating loose stools, diarrhea, which can progress into the Pitta type. There's really a big giant pathology. The Pitta type is more inflammatory, more painful. And once you have bleeding, even if you started off as the Vata type, now you're the Pitta type. Once you have the bleeding, you're reclassified again. Burning and bleeding, then you are officially the Pitta type, even though you may have for 5-10 years just may have had Vata type of symptoms like alternating constipation, loose stools. The Vata we call pushing the Pitta, and then the Pitta becomes inflamed. It's kind of like the wind blowing the fire, and the too much wind will increase the fire, and this is what happens. And why Vata is often the underlying cause, not the Pitta, even though the Pitta is the extreme with the bleeding, is these depleting themselves, fasting, skipping meals, drinking coffee on an empty stomach, a lot of hot spices, detoxing. You notice the trend there, if you understand all those types of approaches, is they're all extremely cleansing. And some of them are even nutritionally depleting, like no dairy, very little protein in the diet, no animal protein, no legumes. Where's your protein coming from? It's not, nuts is not doing it. They're afraid of seed oils. They're afraid of fat. So they're not having enough. They're just eating avocados. So all these are kind of restrictive, extreme, I would say, diets. And they have a kind of a cleansing aspect. And eventually the inside of your intestinal lining becomes raw, just like the carpet burn. It's just becoming more and more and more sensitive. This person, even in the early stages, can be sensitive even to touch. You just touch their skin and they're like sensitive, or even something you say, they become sensitive. So this hypersensitivity is one of the early signs of this condition. So that said, we have most of these products today are available that I'm going to cover on our sponsor site here, Urban Teas, at urbanteas.com. Sponsor, paying for the bills here, paying for my mug of tea. So let's introduce some of these products, which you could get on your own from urbanteas.com. But full treatment, I think you really have to do appointment. And I don't often say that. Sometimes I say that, you could treat this on your own if you have the knowledge. But if it's severe, it's even with these herbs, it would be difficult. But this product is definitely a good start and an exception. Soothing Gut Tea. I've sold this on eBay, and people say, wow, it cured me from IBS, just the tea. So I don't know how bad their condition was, but protects the stomach lining, builds intestinal mucosa, used for ulcers and inflammatory colon conditions. And you can, this formula is also called the 4 demulcents, 4 herbs that are demulcent in nature: marshmallow root, slippery elm, and comfrey root, and licorice root. Oh, there's a little fennel in there, which is for the sweet taste. You can see that. It's a very slimy tea. You make it and you kind of can feel it slime going right down your intestines. And it gives, it's very soothing and gives immediate relief. Probably people who are buying this off of eBay probably have to just keep drinking it every day. And they may just get themselves stuck in that first stage of managing it. They left off enough foods, excuse me, that they don't have much pain, and then they're drinking the Soothing Gut Tea all the time. I'm not sure. Maybe they're buying some of the other products as well. But generally, if we're having the loose stools and the diarrhea, we want to stop it right away. So we usually give out this diarrhea formula. Not to all cases, but definitely if you're having a lot of loose stools, the main ingredient there is bilva. And you could say it says stop if constipated. And there's advanced Ayurvedic formulas like Kamaduta in there that are made of 7 herbs. Shank Basma is like a shell. And Laja Lut there, you can kind of see, is actually one of the key ingredients. It's called the touch me not flower. It's one of the flower, when you go to touch it, its petals, it closes up. And this flower is high in fiber and is very demulcent, and it's very slimy. So when people eat it, they can see it's a little slimy. There's only a small amount in this formula, the diarrhea formula, but it is very, very effective. And it is available on Urban Teas, and it does work very quickly. And usually even in a couple of weeks, we've got the diarrhea under control. Now people think, well, it just stopped my diarrhea. Well, it's really doing more than that. I've seen that it's bringing down the heat, bringing down the burning. A lot of these herbs are anti-inflammatory, and herbs like Arjuna is an astringent herb that's known to help the tissue heal. So it's not just like a pill is stopping your diarrhea. This is starting to heal it, bring down heat, bring down inflammation, and helping the tissue to heal with these herbs like bilva and Arjuna that they're called astringent herbs that make the tissue tighten up and help it heal faster. So there's healing herbs in here. So it's really much more powerful than just saying, okay, it stopped the diarrhea. Now, we do have a couple IBS formulas. There's more than one. Here's one here. We have variations. And, it says for malabsorption and does say leaky gut on there. This is for somebody who doesn't have much of an appetite, more of the Vata type. It's using this Ayurvedic formula called Dadimastika Churna, and Dadimastika Churna is 10 herbs. And you notice one of them has cane sugar, because sweet is very helpful for this condition, but it also is using the pomegranate skin. Pomegranate skin is a home remedy for diarrhea and inflammatory colon conditions, and the Ayurvedic formula Dadimastika Churna has pomegranate skin in it. And this is usually taken before meals. See, this is before meals. It's also available on Urban Teas. Sometimes I'll give it after meals, but if there's low appetite, there's not a good appetite. If they're really hungry, I don't need to give them. It's slightly, it's more for the absorption, the loose stools. You just have to know these products really well to pick the right one. If they're having a lot of pain, like every meal's giving them pain. Instead of that, I wouldn't give them that IBS formula. It's really for the weaker digestion, not hungry, picky, sensitive. But if they're having a lot of pain, then I'll give them this one, abdominal pain formula there. And that one is more, particularly if they have acidity and pain. Then I'll give them this one. So we use it even for stomach ulcers and burning pain. And I don't know if there's some Guduchi is anti-inflammatory. There's that Shank Basma again. It's kind of like a shell and a little sweet fennel. Very simple, but very effective formula to stop abdominal pain. Usually not needed to take for long term. And since it is a digestive condition, generally there's different digestive aids we'll give. This one's the most common, and I do recommend it for anybody with IBS. It's, nice catchy name there, gentle digestive tea. Those with hypersensitivity digestions and conditions such as IBS, leaky gut, heartburn, GERD, acidity, and chronic food sensitivities. So this only got cumin, coriander, fennel, often called CCF, but there is some dandelion in there as well to help. So there's a little bitter as well I added to that CCF formula. It's very gentle. You could give it even to children, and you just sip this with the meals. So you can see I could be giving you something before the meal. I could be having you sip something with the meal, and I could be giving you something after the meal. So, you're really finessing it. And then, of course, at night, you could be taking the diarrhea formula. So, you have to, and these dosages are important. And once you get the person, and then you have to put them on the diet so there's no pain. Usually sometimes we use khichdi, just mung dal and white rice. Sometimes we use rice and chicken. A white chicken, not the fish because of histamine response, not the red meat because of the difficulty to digest, but chicken, usually dark chicken, steamed vegetables, squash, zucchini, pumpkin. These are all fine. Sweet potato, plenty of ghee, plenty of fat, asparagus, green beans. They're all fine. It's the nightshades, the tomatoes, eggplant, bell pepper, and even paprika that are the problem. So we've had some people that had a problem just from the paprika. They didn't realize it was so bad. So we can get the paprika like down in the south and in the bayou there. I got a lot of paprika, chili pepper, fried foods. This can cause it. And then, of course, there's no cabbage family, no raw vegetables. So you got these steamed, soft vegetables that with plenty of ghee. You've got the rice, either brown or white, depending on the bowel movements. But well cooked, soft. And then sometimes we do the khichdi mung dal and rice, or we do just the fish. I mean chicken and rice. I just have to pick that on a case by case basis. If the person's very depleted, I'd rather lean with the chicken. If they're only 85, 90 pounds, and if they're not, then maybe I'll do the mung dal. And even mung dal, I have choices. I have yellow mung, which is no skin. A split, and then green split mung. So these are all choices I have to make on a case-by-case basis. But the goal is to get it under control, no pain, no bleeding, no diarrhea as soon as possible. If the people are very compliant, this can be done very fast in a couple weeks. Some people have achieved it even in a matter of days. Well, non-compliant people who are still eating out, forgetting to take their herbs, slamming down a cup of coffee every once in a while, they can drag on for months and months before they get it under control. And then once it's managed, then we have other formulas like that we call them healing gut formulas. We used to call them something else, but this seemed to be what it was about. This is the Pitta version. We have a Pitta version and a Vata version. This is for colon inflammation, IBS, ulcerative colitis, generally with this is diarrhea and many loose stools a day. There's another version if there's bleeding. We had another herb called nagkesar. And this is the one we won't sell in capsules. That's very slimy. It's, 1 teaspoon and a half a cup of warm water with after meals or more as needed in the day. And it even says in brackets, formula is slimy, so shoot it down fast and don't let it sit long. Best to add some coconut water. And there you see the Arjuna, which is healing the tissue I talked about before. Bala, which means strengthening, that helps strengthen the tissue. Bilva, which is the most astringent of all herbs used for diarrhea, is in there. Katuj is an anti-inflammatory colon formula. Kamaduta Ras is a pitta lowering herb. That's our formula. It's 7 herbs, and that's lowering the pitta, the heat, the burning, the inflammation. Lajalut's a slimy herb, and it's in there in greater amounts. Little licorice is another demulcent, and fennel, again, the sweetness is very important. Sweet and cooling and soothing effects. So this stage of the healing gut, it can go on for a month or two, again, depending on how compliant the person is with the diet. If they're not very compliant and they're, out having coffee and chili peppers every once in a while, this could drag on. Or in most cases, they get better, they stop the healing step 2, and then they go off and party, and then they're back in the ER, and then they come back to me, back on the herbs. They relax, gets better, they relax, they go out and have their drink or chili sauce or tomato juice or Mexican food, and then the whole thing flares up again, and they're back in the ER, and then they're back again to me. Sometimes people have done this up to 3 times before they stopped these habits and allowed their body to heal from taking the herbs. So once you're going through this healing process and it's done, you can start to eat a lot of foods, many foods you couldn't eat before, and then only certain foods you're going to have to avoid for the rest of your life, because like any condition, once you've had it, the reoccurrence is very high. So I hope this helped you have faith and confidence that this inflammatory colon conditions are very treatable, and better to address it in the early stages. If you're in an early stage, yes, just going to herbmanteas.com and buying a couple of those products, herbmanteas.com, over 170 products there, and you could just probably buy the diarrhea formula, soothing gut formula, and soothing gut tea, and you probably could heal it in the early stages on your own with these herbs. But I would always recommend an appointment for this particular condition, particularly in the advanced stages. I wish you all the best of health and happiness. God bless you all. And I hope this inspired you and motivated you to overcome this condition. Thank you very much.